Hormone imbalances. But before we get into the primary subject, we will start with a few basic principles. All symptoms and health issues have underlying causes. The better we understand those underlying causes, the better we can improve, reverse, cure, and prevent those symptoms and health issues. The cells, tissues, and systems of the body are interconnected. The optimal way to manage health is by a thorough understanding of these interconnected systems, mind, body, and spirit. Hormone imbalances are incredibly common and affect the majority of women one way or another. The three most common hormone imbalances for women in America are: number 1, thyroid hormone deficiency; 2, estrogen dominance; and 3, low testosterone. For an underactive thyroid, some of the signs and symptoms include unexplained fatigue, difficulty losing weight, feeling cold all the time, puffiness to the face and or extremities, thinning hair, dry skin, unexplained constipation, depressed mood, memory problems, brain fog. Sound like anyone you know? Why are so many people with a thyroid disorder undiagnosed and undermanaged? One primary reason an over-reliance on a single blood test called thyroid stimulating hormone, aka TSH. The majority of people who have a thyroid condition will have a normal TSH level, so go undiagnosed and unmanaged. And even those who have been diagnosed with hypothyroidism are often undermanaged because the TSH is normal when it is rechecked for monitoring. There are many other tests that can be done to give a more complete picture of thyroid activity. Some of these include free T4, free T3, reverse T3, antithyroid peroxidase antibody to help determine if the person has an autoimmune inflammatory process, RBC magnesium, hair analysis, thyroid ultrasound, and others. To make the best clinical decisions, it is generally preferable to have as much information and from as many sources as possible, including a full review of systems, a physical exam, a variety of blood tests, and sometimes tracking of a person's basal body temperature first thing in the morning before they get out of bed. Every day, in just about every endocrinologist office in America, people go in for consultations, complaining of fatigue, weight gain, constipation, and other symptoms, and are told they don't have a thyroid condition because their TSH blood test is normal. But even one or two other tests, especially the free T3, the active form of thyroid hormone, would give a more complete picture. Don't accept a normal TSH alone. Do research. Consider working with a functional, integrative, or naturopathic provider who will go beyond a single blood test. Estrogen dominance is incredibly common in the first world and most likely related to endocrine disrupting estrogen mimicking compounds and toxins that we are exposed to on a regular basis in modern society. From exposure to pesticides in food, phthalates and BPA in plastics, chemicals in health, beauty products, and other sources. Some of the signs of estrogen dominance are heavy menstrual bleeding, intense menstrual cramping, breast swelling and tenderness, breast cysts, endometriosis, uterine fibroid growths, PMS, migraines and other headaches, mood swings, bloating, weight gain, and insomnia. What is the approach of mainstream medicine to these signs of estrogen dominance? Heavy menstrual bleeding and cramping, oral contraceptive pills, breast cysts, mammograms, biopsies, and the pill, endometriosis, ultrasounds, surgeries, and the pill, uterine fibroids, ultrasounds, surgeries, and the pill. Low testosterone is at epidemic levels for men and women of all ages in every first world country on earth. And the majority of people with this common chronic health issue are unaware. This is the final. Signs and symptoms of low testosterone are chronic fatigue, apathy and lack of motivation, low libido, depressed mood, trouble with focus and attention, weight gain, lack of stamina, erectile dysfunction, low bone density, and infertility. So what happens when you have hormone imbalances like thyroid hormone deficiency or low testosterone and others, but don't get the proper testing and are undiagnosed? You're diagnosed with depression and get put on antidepressants that don't help your mood. You get diagnosed with ADD and are given stimulants to improve your focus and energy. Maybe you ultimately get diagnosed with chronic fatigue syndrome and are told there's nothing much to do. And or you get diagnosed with irritable bowel syndrome because of your chronic unexplained constipation. You struggle in your relationships, exercise less, gain weight, see lots of doctors, get a lot of tests until eventually you're referred to a therapist and a psychiatrist. That leads to even more frustration and hopelessness because you know there is something physically wrong and any mental health difficulties are secondary. Hormone imbalances are common and generally underdiagnosed and undermanaged, but there is a way to figure out which hormone imbalances and deficiencies most likely explain your chronic health issues. The Root Finder analytical system at complexhealthsolutions.com.
I hope you found this video enlightening and that the information helps you sort out the root causes of your chronic health issues.